Carey?
Yes. We're all ready to go? Yes?
Yes.
Okay. So we have our next patient. Can we get that on the camera? Okay. So we have the next patient here who's a 56-year-old woman who's had an injection 4 years ago somewhere in this region, her lips and a few other places. I'm not exactly sure. So the most important thing before starting to inject is to analyze the patient's face and to see what we can correct, because there is an asymmetry here. So if we look, for example, on this side of the face, we can see that this groove here, that perhaps there's just a little bit too much of it down here. But again, we don't want to make it like this to make her looking too fat. But on the other hand, I find that this little bit of a depression right here, we should maybe just sort of soften that area up there. This side, however, has got another issue, that there is a swelling here, and so I don't want to. I find that if we put anything in this area or back in this area, we may just make that look a little too full. So I don't know if this was at some point she had some filler or something there, but you can see that there is a bit of a bulge there. So the area that we're going to try and work on today is that she's got a bit of a groove. We've got the mid-cheek groove going down here. And I'm just going to ask her to open her eyes for 1 second.
Откройте глаза, пожалуйста.
Okay. And you can see that she does have these medial fat pads here that we can't, surgery would certainly do that, take that away. But if you look when you do this, for example, and she can close her eyes if she wants. When you do this, we can soften that groove up. We can make this fat pad look less visible, because as you inject in this particular area here deep, as it puts a stretch on the retaining ligament, as Alessandro showed you earlier today, this can help to push the fat back into its proper position. And again, she's got a wide structure. She's got a very prominent zygomatic area, as we often see in the Ukraine or in Russia. And so we don't want to give her, fill her up like this to give her too much volume there. So all we're looking for is to correct this area, soften it up, make her look better, and make her look natural. So the areas that we're going to work on today will be in this particular area here. We're going to inject here again. Remember what I mentioned to you, you follow down from the limbus. So, and there's the orbital rim is right around here. You can feel the rim is here. And so we're just going to go down about a 3/4 of a centimeter, and my first injection point will be right there. And in this case, we may put a little bit over here to try and help to support the tissue. We'll put a little bit out here, and we may, in fact, like the male, if I need to, I might put a little bit here, but I'm going to try and avoid that if possible. So we're going here, and then we'll use some Redensity 2 along this particular area here. Now, in this case, you could use, I might, in fact, consider using Ultimate as a deep base, and then use either the RHA 3 or 4, but just because of time, I'm going to use the RHA 4, both deep and superficial. And then the other areas that we're going to do, we're going to put a little bit of filler into the glabellar area. What I also plan on doing with her is I'm going to try and you can see that she's got a very broad, flat sort of nostril here. And you can actually make that extra width look narrow if you just kind of make a little bit of an elevation right dead center in this area here. It will tend to give her a more finer looking nose. So what we'll do is we'll put a little bit in that area. She's got one very, very superficial wrinkle here. If we have time, we'll put a little RHA 1 into there. And again, my big favorite, putting some 3 into her lower lips again, because the ratio here is 1 to 1. So let's get started. So we're going to take and I'll take a dry gauze. That's the pen. 4, okay. And okay, thank you. Okay, so we'll just have you turn your head this way. And again, the same sort of thing. I make that cushion there, And she can close her eyes if she doesn't want to look at the pen, or we're going to just go right in, down to bone. Going to put in about 0.2. Now I'm coming up, I'm bringing the needle up. And we can pull the needle out and have a look at this point. So we got a nice elevation there. I'm just going to wipe this stuff off so you can see properly. Do you have a bit of a wet gauze we can use to? Yeah.
Okay.
So again, this is probably one of the most important areas to inject. You can see already just with that very small amount of material. Just let me get my glasses on so I can read what we've done. So I put in a total of actually it's that's only 0.15 mLs of product. So again, that sort of shows you the point that I'm trying to get across, that this sort of stacking of product, you can get a lot of mileage or a lot of improvement with a very, very small amount. So let's put in a little bit more, because you can probably get that up just a bit more. So we're going to put in about 0.01 there again. Now we're going to come up a little bit, and we're going to call it a day. So you can see that can you back up your camera? So already you can see that there's a dramatic improvement in that particular area with a very small amount of material. So I've used there, now we're down to that 0.35 mLs. So I'm now going to go just a little bit laterally. I'm not going to put very much, just stay where you are, with the camera where you are, okay? Back up. Okay, so we're just going to kind of go, again, about a ½ centimeter from there, go down, and pick a point that you think is appropriate. So I'm going to go right in there. I'm going deep. I'm going to come up a little bit. So I'm going to probably put a little bit more superficially, because we just want to kind of pick that area up, but not put a lot of volume in there. So we're just going to maybe put that down a little, because we have to deal with the fact she's got a hemangioma right here and underneath here that are also giving a protrusion. So we don't want to make that too prominent. And you can see that already from that correction that we've done here, that this area is now improved. So we mentioned we were going to maybe go to that area. I'm not going to do that. So I'm going to take if you can give me a Redensity 2 on, you can just give me a syringe. I can do it without the pen. It'd just be simpler. So now what we're going to do is I'm going to just go to see if we can soften up. You see, you can take the thing is, if you take your finger and you can do this and you can soften it up with your finger, it tells you that the Redensity 2 is going to work very, very well, okay? If you do this and nothing happens, it doesn't move up very much, you're going to have it's going to be a little bit more difficult to improve. So I've got now the Redensity 2, and what I want you to observe is that what I've done is that I've bent the needle again about 30 degrees, and the reason I do that is that I can go, let me see.
Yes.
I'm going to go in with the needle straight down like this. It's going to be going perpendicular to the skin. I'll do it like this. So it's going to go perpendicular. I'm going to pull back a little bit, and then I'm going to slide along the bone. Just stay, don't go in. Okay, so very simply, all right? So I've created a little bit of a cushion. That's the area that we want to fix, all right? So we're going to go down, back, and slide along the bone. And now I'm going to inject as I withdraw. So small amounts. And you can actually see a little bit of elevation as you go. And we'll just pull that needle out there. And we've got rid of almost most of that groove there with a very, very small amount. I've used 0.1 ml of the Redensity 2 to completely eradicate that. So this is why I understand that, there's a difference between cannulas and needles, but you can see that we've had really no bleeding whatsoever. And you can see exactly what you're doing. So I'm just going to see if I can push that little area here a little bit further. So let's do that. So we're going to go down to the bone, slide across, and then we'll just inject a little bit there. So just in that one little area, we're going to make a little pool, and there we go, sliding out, and there we go. So we've really corrected that area as far as I want to correct her, okay, with a very, very small amount of material. That's 0.15 of Redensity 2 and 0.35 of the RHA 4. So, before I would probably have told you I would have used twice the amount of that material to get that kind of results. So just remember, when you go back to your office, if you want to do it with a cannula, just go, if you're going in with a cannula, go deep, and then do your bolus or whatever you're going to do, come back, and then bring it up a little higher and sort of sandwich the product, and you're gonna get a lot more mileage out of your filler. So let's move along. How are we doing for time?
Как у нас со временем? Кто нам подскажет?
Can you give me some the RHA 4 again that was on the?
Yes.
On the so let me just show you. How many? 15 minutes. Okay. All right. So can you back up your camera? Okay, so this is the area, and just tell them to stay there, okay? Not to keep coming in, okay? So this is the area that I want to fill in, this little groove here, okay? But I don't want to eradicate it completely, but I want to just sort of soften it up. So again, what you can do is just take your needle here. There's the central area here you want to fill, okay? And I'm just going to go right in, inject, as soon as we get the battery on.
No, just...
Okay, no, it was just turned off. It was turned off. So we're just going to inject 0.1, bring it up a little small amount, okay? And we'll put another little bit. So we're just going to go over here now where we see another little bit of a depression. Now I'm superficial.
May I ask you, what kind of product do you use right now? RHA 1 or 2?
No, this is RHA 4.
4.
So when you're going to do these kind of grooves, you've got to use either 3 or 4, okay? And in this case, because if she was a younger girl, I would probably tend to use the 3, because I would probably want to not use too much product, and I want to bring it up so I would be a little bit more superficial. But when I look at her now, you can see that I've got that kind of groove, that accentuated groove that she had there is now gone, and again with a very small amount of material. And then the other thing is that when you pass your finger on this right now, you don't feel anything. So you know that, can you ask her to smile for me?
Улыбнитесь, пожалуйста.
So when she smiles, you don't see any bump forming there. Whereas before, as I mentioned to you, you can go to places that you didn't go before because you don't have to worry about lumps. If I had tried to put Ultimate there, or Ultra Deep, if I had put just too much, just a little bit too much, you could probably see that when she smiled that you might see a little bulging there. But look at that. I mean, it looks totally natural. Let's take this ink away. It looks totally natural. And when she has facial movements, as we're talking about, these products are dynamic. They're for the dynamic area of the face. We see that it doesn't create any bumps because the product stretches with the skin as you move. All right, so let's move along. Just because we're talking about temples, let me do a temple. We can see that she's got one temple that's a little bit more depressed than the other. You can see that this temple here is a little bit more depressed. So a nice little simple thing to do. Again, this is, I'm going to need another 4, actually, if you can put another RHA 4 in there. So what you want to do is you want to feel for the crest. And I'm just going to grab a pen, one sec. Yeah, black, good stuff. Okay, so we've got the crest that runs right along here, okay? So you can, right here, all right? And so what we want to kind of do is you want to inject in this area here. We want to put our filler. And what you want to do is you can see that she's got a nice big blood vessel running right here. You don't want to hit that. So if that was the particular area that I want, you can actually move the skin over, okay, and then inject in there. So we want to find an area. I look for the area of maximum depression, so this would be the area that I want to do. And you can just take the needle, go right down to the bone, and then you inject in a plane where you're not going to have any vessels and you're not going to have any nerves. And you can generally do probably 3/4 of a cc to 1 cc in this area. She doesn't have much of a depression. And again, what I'm starting to do in this area, as I'm coming up, I will again inject it a little bit more in the superficial component, just to dropping a little bit of stuff in there. And again, I think we're saving a lot of material. So we're almost ready to go. And the other thing we'll as I mentioned, we're going to do her glabellar lines. So while we're waiting for the needle, I'm going to show you what I do when I do glabellar lines. Is that I do this, okay, just like I do with the kind of the lip. And there's a reason I do this, is that one, by picking this up, you want to stay in this area when you're injecting fillers. Contrary to up here, you want to be more superficial, because if you recall, we talked about the vessels are deep here, then they become superficial here. So I'm picking this up, I'm lifting it away from blood vessels, and I'm compressing at the same time. RHA4, okay. Where was I going to go with this? Well, I'll tell you what. We're going to do the temple area here. That's it. Yeah. So we're just going to have you bring your head over there. So again, I'm not in the best of positions, but I like to go straight down. So we'll go right down to here. We're down in bone, and we're just going to inject. So I'm going to judge that we're going to put probably 0.3 or 0.4 mLs in that area. And again, if you're doing this by hand without the pen, I strongly suggest you inject very slowly. Okay, I've a number of times. In fact, at a meeting in Monaco, I almost stopped one of the injectors who put in 8 syringes, 8 cc's of material in less than 15 minutes in a patient, or 10 minutes actually he had. And he put in like two syringes, like just shooting like a gun in there. So just, for the safety, you're not going to have problems with emboli if you inject slowly, okay? Because if you inject slowly, even if the product went into a blood vessel, you're going to probably be okay, but it's when you press hard and you force it up into the arterioles of the skin, that's when you get into problems. So as long as you remember to inject slowly, you're not going to have problems. This is the big advantage of the pen. It controls you, okay? Because it only goes at a certain rate, and so it controls you from having too much excessive injection of material. So you can see that with this small amount of material, we brought her temple up nicely. So we're going to stop at that area. I want to. How am I doing for time now? 10 minutes. Okay. While we're here, let's do her nose. So you can see from that picture there, you can see that she's kind of flat there. You can see that there's a blood vessel running right down there. So what I do with this is I'm going to lift up the skin. Okay, I'm pinching her up. I'm going to take the needle and I'm going to put it right on the bone. Okay, so I'm right on the bone there now. And I'm going to kind of do little injections. So I'm going to keep my finger here to try and prevent the stuff from, it's going to, the filler is going to try and find the path of least resistance. And just get a little bit in the central area. And then we're going to just kind of massage a little bit here. And already with that small amount of material, we're starting to get a slightly thinner looking nose. So we can see that down here, there's still a little bit. So let's go down here. So we'll just duck. Okay, you can see we're in. Keep my finger there. And you can do little tiny, shots with this stuff. And you can actually, look at the advantage of doing this with the, you have a cannula in there. Your patient's going to lie down. You're not going to see. I can see exactly what I'm doing. I know where my tip is, and I'm just putting a little bit more there. And very quickly, I've got exactly what I want. And we're just going to mold this a little bit. And now her nose looks finer, looks thinner. We got a little bit of a bump here. We'll just push that out. Just massage that area there. And just turn back towards me. Okay. And you can use a Q-tip or whatever you want in there. Do we have some of the Ultimate there?
Yes,
Yeah,
of
okay.
course. Should I prepare it?
Yeah, just on a syringe is okay.
Insert, okay.
This is the 4. Let me just again, it's in time. Let me do this with. Listen, normally, what will let's do her lying down? Can you push your room?
Лягте, пожалуйста. Lie down, yes?
Yeah. And also if you can prepare a 3 for me on one of the other pens you have.
No.
Or no? Okay, so we'll do that in a second. Okay. So this is how I'm going to do this is how I do the glabellar. Can you, again, kind of same principle. You want to have the needle flat against, so it's going to be basically lying like this on the skin, okay? So, let me just see. Let me come. I think the easiest way I'm gonna inject the way I don't normally inject, but just so that you can see what we're doing here. So typically I go the opposite way, but in this case we're going to go this way. So you want to bring up the skin. So you want to have so that the skin is. You can see the skin is horizontal here, and we're going to go in, slide along, and then I'm going to inject as I come out.
How deep you are?
I'm probably deep dermis there. And again, one of the products that I typically use in this area is Global, or in some patients who've got really deep grooves, I love Ultimate. I put Ultimate in my own groove, and I just like the results that I get from that. And I don't worry about, you don't really get any bumpiness from that. Patients may feel a little bit of a ridging there for a month or so. So now what I'm doing, this is another thing that I often do, is I do almost like a sub-incision. Like I'll just kind of go back and forth a little bit like that, creating a little bit of a pocket for the material, and then inject as my final thing. So you can see that the skin is a little blanching there, so that also tells you how much material you got in there. And so already we can see how we've basically softened that groove up. And then I'll just go over here. Can we lower the head down of the bed?
Should I prepare an Ultimate?
That's okay. I can manage. I'll do it after. But if I could get a Redensity RHA1 on a needle, just a regular needle is fine for me. Okay. All right. So let's just finish this guy up here, so we don't have to slide. I'll pull away here in a sec. So there's the needle is in, and I'm going to go back and forth a little bit. And you see, if you're moving like that as well. If you happen to be in a blood vessel, for example, you're not going to get a lot of material in there. All right, so we're going to now get rid of her little. I'm going to just show you what I do with on the lip line here, because we're running short on time. But you can see how that's really nicely removed the groove that she had there. And just one sec. Let's see what. Okay.
RHA1.
Yeah, okay, great. So I've got the RHA1 now, and again, I really love doing it on the pen because I find it very easy, but we're just for purposes of technique. So you can inject the lip, there's two ways that I inject the lip. The one is that I pinch the lip, and then I do exactly like what I did with the glabellar, that I go back and forth, or you can stretch the lip, like this, okay, and do the same sort of thing, okay? So just because it's going to be easier for you to see, I'm going to stretch. So you can put the needle, lay the needle, that's exactly the wrinkle that you want to get, and then you stretch it out. Now look how superficial I'm going to go here, okay? I'm going to be really high up. I can see almost the gray, and you can see the motion of that needle, and now I've injected, okay? And we're finished already. So you can go, we're going to just go back there again for one more sec. Sorry. So we're just going to go in there again, very, very superficially, and put a little bit more. We just kind of, and again, you have to be careful about trying to make not to make too many holes, because as you inject, you know, it will start coming out of other holes. So in this case, there's really not a lot to do in there. Let me just quickly do her lip. If you can give me an RHA 3 on a needle, just a regular.
Okay.
We'll just kind of quickly show you what we can do with that lower lip.
Oh yeah, that's okay. You can do it.
Oh yeah, we have more time? Yeah. All right. So let's see. Which one? On a 30 gauge, with 3 on a 30 gauge. Let's look at doing a wrinkle around the eye here. Okay, I mean I usually use toxin when I do for these areas here, but just to show you what you can do here is, again, you can just slide along underneath the wrinkle very superficially and inject as you come out. Okay, you can see the slight elevation there. Okay, there's just a little bit. Is that coming up all right?
Yes.
Yeah, you can see that?
Yes.
Okay, so we're just coming up, and then we stop. And then you take your finger, or even better, a Q-tip. Do we have a Q-tip there? A Q-tip? So there you can see that wrinkle is essentially gone. There we go. So just take, after you finish doing the injection on that area, take the Q-tip and just rub it like that, okay? As simple as that, and you can get rid of that. And look at, hey, there we go, we got a neckline there. Well, let's see if we have, not too good. Well, there's a bit of one. Well, let me do her lip, okay? Let's, that's the 3?
Yes.
Thank you. Can you tell her I'm injecting her lip and that I'm not going to do anything crazy?
Людмила, сейчас будут уколы в губу. Чуть-чуть будет неприятно, но глубокие вдохи потерпите, хорошо?
So sometimes in some patients, as the philtrum becomes flat, you know, when they're lying down, it may be difficult. So you, again, just take your, let me, if I can get a pen again, please.
Pencil, yes.
So you take your needle, there's the center of the lip.
Pencil.
Thank you. So there's the center of the lip, just there, okay? Again, so we talked about, we want to kind of go in this area here and this area here to get the volume there, okay? So again, pinch up the lip, I go dead center, and now I'm injecting constantly. As I'm moving the needle, product is being injected. So the nice thing again about the pen is that I have to look at the needle to see how much has come out, the syringe, whereas with the pen you can usually hear the amount. So we've done, that's 0.15 mLs. Okay, close your mouth. So we can see that, just open your mouth for a sec. You can see that there's more volume on her lower lip. Again, we're going to go onto the other side. Now we're going to come back there, but I just want to kind of get a look. We want to have a reasonable size for a woman of her age. So we're just going to go back here, back and forth. And be careful that you don't go too far forward with your needle, okay? Like when you're injecting here, you don't want to go out too far out here, otherwise you create a little bit of a bump there. Close your lips, Sarah. Can you tell her?
Закройте губы, пожалуйста.
Okay, just open up.
Открывайте губы.
So we see that now with her mouth open, she has a much more voluminous looking lip, and we can see if we can push it a little bit more. So now I'm going to go a bit on the side here. We're going to take a little bit over here, up. Just give a little squeeze there. Over here. So you can see how you can really do this, you can really quickly get a nice result. All right. We have a wet gauze. Is this a wet one here? Yeah.
Yes.
Okay. All right, let's have a look. Thanks.
Wet one.
Thanks. So now we've got a nice lip. Just close your mouth. Close your mouth.
Откройте губки.
Okay. So what I'm going to do, she's got a nice volume there. And the other thing is, I would much rather with a lady like this, because she's going to get some swelling, and when she goes home, so I would rather have her come back and add a little bit more. She'll feel a lot more comfortable, and then the next time she comes into your office, which is going to be probably in 9 months to a year, she's going to be very comfortable about you doing whatever you'd like to do with her lips. And it's surprising to me sometimes how long this product, the RHA 3, can last. I injected my technician in my office close to probably 9 months or a year, and it still looks very good. So that product can give a very nice look. Just open your mouth for me. Can you ask her to open the mouth? Okay.
Откройте, пожалуйста, рот, да.
I'm just looking. So, this is a patient that what I would probably in my office want to do with her is to give her philtrum back. Again, you see she's lost the philtrum here, and this would give her a very nice look to her face. You again remember that the philtrum starts at the peak of the Cupid's bow, which is right. I'm going to take that pen for a sec.
You should have it.
I have it.
Near you, yes. Yeah.
Maybe give me another one. I don't know what it did with it. There we go. All right. So again, you see sometimes in an older patient it becomes very difficult to actually even see where the philtrum is, but there's the philtrum start there. Those are the points that you draw. And try in an older woman to stay more on the inside, shorten it up rather than going too wide, because the philtrum as you age becomes wider. So you don't want to accentuate that. So what I would do in her case is that if I was going to do her philtrum, is that's kind of, I would put those points like this. You draw here, you draw here. And that's where I would raise up. And here what I would often use is I would use either something like Ultimate or a very dense product to create, you want to create a bump in this case. And then what you can do, which I don't, as I mentioned, I don't inject lips, the edges often, but here I do. And what I would do is I would inject a little bit of the filler to basically recreate the Cupid's bow again. So that's what I wouldn't go in her case. I probably would not go any further down here, but what I would do is I would just bring this area up here, there, and stop at this point here, okay? Let's see where else we can go. Are we okay for, yeah?
Yeah.
You want me to keep going?
Till 5, so we have.
I have what? Oh, I have 5, okay, 5 more minutes. Where do you guys want me to go? Let's see what we got here.
What part of the face?
Which one?
Which part of the face?
Yeah, just leave it. Okay, let's have you sit up again for me for a second.
Сядьте, пожалуйста, Людмила. Вы назад, Миша. Михаил, вы назад. Вы с камерой. Окей.
Everything okay? Good.
Вы себя хорошо чувствуете?
Да, спасибо.
All right, so let's put a little stuff down. We'll do a little bit in her nasolabial line. What do we have? Do you have any? 3?
3, yes.
3,
it
perfect.
is. Yes,
Okay,
this is
and-
RHA 3.
Okay, so again, as I mentioned, we're going to inject the RHA 3, and this is actually on a 27 gauge. I would probably use a 30. Is that a 30 or is that a?
30, yes.
That's a 30?
it's
Okay.
30
It looks a little bit from that. All right, so let's just kind of go down again, inject as you come back up, and then superficial. And again, this is a product that we don't feel it in contrast to the other products that we've been injecting in the past. Okay, now I'm going superficial. I'm injecting constantly as I'm pulling out. Okay, we're going to bring that over here. And here up. Go. Can you ask in the audience, is there any particular area they would like me to inject? Is there some area that they're wondering about, or?
We have
It
got
was hypodermis, no?
That was both deep and then in the hypodermis, exactly, yeah. Can you ask the audience if there's a
Yes.
particular, yeah?
Есть ли какая-то зона, которую зрителям в зале хотелось бы увидеть, как делает Wayne?
We
No
have got for
comment?
density 2 and RHA 1.
All right.
And a few droplets RHA 4.
And let's see where else we can go. So we can, well, let's maybe do a little bit of the philtrum. Is she being frozen here, or?
Замораживали тут, не замораживали.
Yeah?
No.
A bit.
A
A
bit.
little bit, yes, a little.
All right,
Людмила,
well,
сейчас будут укольчики над верхней губой. Не очень приятные, но потерпите.
all right,
Да.
so grab me that, if I can get the pen back in.
I'm sorry, our customers want to correct the lips and colonus of philtrum.
Not, they want the philtrum or they don't?
Yes,
They want it, okay, philtrum it
They
is.
Pen
want
or
to correct
pencil?
the lip.
The lip, okay,
Yes, they want to
All right.
finish this lady for a completely beautiful
all right, so
lady.
can I get the pen first? And a
Pencil,
pen.
yes.
Pen. Yeah, pencil.
Yes.
Okay, thanks. And if you could, let's see what we're going to use here. If you can give me,
RHA 3.
give me
Pencil you have got in your
yeah,
hands.
okay, good. So give me the four on the pen, all right? So again, let's go back and just draw where, this is where it takes a lot more time to draw than to actually inject. So again, that's going to be my point there. And that's going to be my point there, okay? Again, I'm going to try and err on being less. So you want to sort of sketch this. So we'll put there. So remember that this pole here is always in, and this is always wider in most cases, okay? So we're going to kind of go, put your head back. That's going to be kind of my injection point there. All right, so I'm going to have you come back. Thanks.
This is the 3, you don't need it?
So, which one?
The 3.
I'm going to take the 4 actually on the
Four,
pen.
yes.
So, normally what I would do is we had a tool that was built by Teosyal that was like a pincher that actually pinched the skin for me, okay? You can actually buy in a hardware store those measuring things that have that slide back and forth, and it facilitates sometimes making this ridge here because you want to keep the product superficial.
4.
Okay, so we got the RHA 4. So again, bend the needle, and so what I'm going to do is that we want to inject as we come out along this area here. And it's very important, again, to pinch hard because, again, the filler will tend to find its path of least resistance. So if you inject, it will start to go out here. And as you get down to this area here of the lip, you have to be careful because as you're injecting, the filler will all of a sudden start shooting down the lip edge, okay? So we'll start, and one other point is that you once try and make almost one hole only because this product, once you've made a hole, it will tend to leak out of there. So wherever I enter here, I don't want to remove it, and I can actually push the skin along the needle, and I can reach the nose just with this needle. So let's go here. All right, so we'll go up. And we're sliding. Now I'm higher up than we really want to be normally with the 4. And I'm going to inject, and I can feel it against my finger as I'm coming down. And I can look, I can put the needle down, see if I'm getting the results that I want. So I'm just kind of working it down. And I don't know what kind of results I'm going to get with RHA4 because I don't generally use that here, but I'm hoping for that we're going to get a good cosmetic result. And again, I think I can feel the ridge. So again, you can always go back and add more. There, so you can see now it's starting to come out. I actually accidentally punctured the area. But let's go on to the other side now. So I don't know if you can see that there, I can't, but you can actually see that there's a ridge there now along the right philtrum. So let's go over on the left side.
Do you need wet one?
No, I'm okay, thanks. So sliding along, very super, just underneath, within the dermis or just underneath it. So look at what I'm saying, that you can see you can now reach right to the tip of the nose by pushing the skin there. All right. Oops, there we go. Let's just hold that for 1 sec. Just going to hold that one for 1 second, so I'm not bleeding. And it's surprising how just getting a philtrum, what a difference it makes on a lip. Again, if you remember that picture of the ape, which has no philtrum at all. And we'll just be 1 second here. I don't want to let go for, see if it's stopped. So there we can start to see the natural sort of philtrum there. Now what we're going to do is we're going to go along her lip edge. I'm going to take some Redensity or RHA2, please. Or if you don't have that, if you have the Redensity 2, do you have RHA2 or
Redensity 2, yes,
okay.
We should have. Yes, please. On the needle, yes.
On which one?
Needle or pen?
That doesn't matter. If it's on a needle, is it on a needle? Yeah,
Yes.
just like that's fine. That's just for interest. So you see now she's got a nice. You can see that there's a groove. She's got the philtral groove back, and there she's got a nice sort of philtral groove there. So it's really just an architectural detail, but a very important one for a good-looking lip. Okay. So we're just going to kind of go along here. So what I do is I again. Pinch up, so that's the area we want to inject. Slide along. And now it's cut. So when that happens, when you start getting out of the hole, you just need to pull your needle back a little bit and find a slightly deeper plane. So here we're going to go here.
So could you repeat? Here is Redensity 2 and in...
Normally I would probably use the RHA2, but I don't, but just because we're kind of in a bit of a rush, I'm using the Redensity 2, which I know is a good product in this area. So just a little pinching there as well, small amount. So there she's got, we start seeing the natural appearance of the philtrum, the cupid's bow. See if we can clean it up a little bit there. Let me just hold that for 1 sec. But she looks, I mean, she could walk home and nobody is going to know that she's done anything on her lips. And can I have you smile? Can you ask her to smile?
Улыбнитесь, пожалуйста.
Yeah, okay, she's probably frozen as well, I guess so. All right. So, are we more?
No, it's...
Okay. Good. All right. So anyways, Olga, thank you very much. Thank the patients for their... Okay. Oh, you have... Okay. Oh, I have to go. I have to come out. Okay. I'll be right there.
Can you please sit down and show
Okay. Yeah. Can you sit up for a sec, please?
Сядьте, пожалуйста, Людмила. Can I take it away?
So let's just have a look at... let's get if we can get a bit of a dry gauze again, okay?
Dry gauze,
Yeah.
yes.
So we've done the temple, we've done the glabellar area. We can see that her this area here is markedly improved. We've done the area down in this area. We've softened that area up here. We've created the philtrum, the normal philtral groove, and that's a wrap.
And nasolabial?
And the nasal, well, we only did, a bit of the nasal labial there as well, yeah. So there, again, she could probably do with a little bit more after we finish here. I'm going to probably go back and put a little bit more in that area. But what I do like about it, just open your mouth, just with her mouth kind of relaxed. She's got a very natural looking lip. It doesn't look like she's been, it's not her upper lip will swell tonight from the injection, so that she has to plan that maybe for a couple of days, people might, or somebody might suspect that she did something there, but they'll never know that they did anything on the lower lip. Okay? So I'll go into the, all right. Placebo? Placebo.